How does the side name affect CFS diagnosis? Imagine trying to explain a complex illness with a name that doesn't quite capture what it really is. That's been the challenge with chronic fatigue syndrome, which many now know as myalgic encephalomyelitis. In 2015, a new term called systemic exertion intolerance disease was introduced to better describe the core feature of the illness, the severe intolerance to physical or mental exertion. The idea was to shift focus from just fatigue to the broader picture, including symptoms like post-exertional malaise and unrefreshing sleep. The hope was that this new name would help reduce stigma, make it easier for doctors to recognize the illness, and improve diagnosis accuracy. The diagnostic criteria under the SEID name focus on three main symptoms. First, there must be a significant reduction in the ability to do daily activities that lasts more than 6 months. Second, patients experience post-exertional malaise, which means symptoms worsen after even mild activity. Third, unrefreshing sleep is a key feature. Patients also need to have either cognitive issues, like memory problems, or orthostatic intolerance, which causes symptoms to worsen when standing up. These criteria are simpler and more practical for doctors to use compared to older, more complicated definitions. Despite these efforts, the name SEID has not been widely adopted by major health organizations like the Centers for Disease Control and the National Institutes of Health. They still primarily use the terms chronic fatigue syndrome or myalgic encephalomyelitis combined with chronic fatigue syndrome. This resistance comes from various reasons, including concerns from patient groups who feel the new name might not fully representing their experience, and the desire for consistency in international research and clinical practice. Because of this, the impact of the SEID name on actual diagnosis has been limited. Many healthcare providers still diagnose and refer to the illness as CFS or ME/CFS, and the diagnostic process remains largely the same. For people living with this illness, the debate over the name can feel frustrating. The term chronic fatigue syndrome often makes it seem like the main problem is just being tired, which can minimize the severity of the condition. The introduction of the SEID name was meant to highlight how exertion makes symptoms worse, but since it isn't widely used, many patients feel that their condition isn't fully understood or recognized. The new criteria, however, do help clinicians focus on key symptoms like post-exertional malaise and sleep issues, which can lead to more accurate diagnoses and reduce misdiagnosis. It's important to remember that diagnosing CFS or ME or SEID is still a process of exclusion. Doctors need to rule out other conditions that could cause similar symptoms, like thyroid problems, sleep disorders, or mental health issues. This process can take time and requires a healthcare provider familiar with the illness. While the new criteria and the name SEID aim to improve understanding, the actual diagnosis still depends on careful evaluation and clinical judgment. In the end, the name SEID was created to better reflect what many patients experience and to improve how healthcare providers recognize and diagnose the illness. Although it has not replaced the older terms widely used, the focus on core symptoms like exertion intolerance and sleep problems is a step forward. For patients, the ongoing discussion about names and criteria underscores the need for greater awareness and consistent standards in diagnosis. As research advances, future updates might make the process clearer and help reduce stigma, ensuring more people get the support and understanding they need. Always remember, if you suspect you have this condition, consult a healthcare professional for personalized advice and proper evaluation.